Hi, I'm Dr. Ashish Dutta. I'm a cosmetic surgeon at the Aesthetic Beauty Center. Botox is a protein which is obtained from a bacteria called Clostridium botulinum. The chemical is purified and then injected in very small amounts into specific areas to either weaken the muscle, or of course sometimes we use it for chemodenervation. That means chemically we are weakening the nerve which produces a particular effect. Say for example wrinkling of the face when we are moving the muscle, or producing sweat in the underarms or other areas where weakening the nerve which supplies the sweat glands. Hyperhidrosis is a condition which is excessive sweating. That is, the patients at least perceive, or sometimes really because of hormonal influence etc., they sweat excessively, and that causes huge amount of discomfort in their personal life, social life and even work life. Excessive sweating in the past used to be treated with surgical procedures and various other treatments like iontophoresis etc., but now the gold standard for hyperhidrosis treatment is botulinum toxin or Botox. The commonest areas for treatment are the underarms. Some people will of course come for treatment for their palms or feet, but now we have started to treat people who sweat from their forehead or even some other parts of the body like the groin area. The treatment can be geared or varied according to the individual patient's needs. Some people are so conscious of their sweating that they have difficulty in going to work or even have to change their clothes while at work, and I think the treatment can actually change their life, because the treatment, once it's done, and if it is effective, which it is in about 80–90% of cases, can last for up to 6 to 8 months. Botox is a toxin or a protein which works on the nerves by producing an effect called chemodenervation. That means chemically it denervates the area so the nerves don't function very well. So Botox actually stops the sweating or reduces the sweating by affecting the nerves that supply the sweat glands. Fortunately, the treatment of Botox for hyperhidrosis are not very common. The most common side effects that we come across are discomfort while injecting, and very rarely patients will complain of that the Botox hasn't worked very well. To reduce the pain, particularly when injecting the palm and the sole where the skin is very thick, we apply a local anesthetic cream and we let it lie there for about half an hour, or sometimes the patients are really complaining of discomfort, we do a nerve block to take the pain away. Sometimes the Botox can travel into areas where it is not intended to. There are underlying muscles which can feel a bit weaker for the first 3 to 4 weeks after the treatment, but again these side effects are not very common. Hyperhidrosis is more of a social disease, but of course it affects people's work, their day-to-day life, and I have known people who have avoided going to meetings because they were scared to go there and shake somebody's hand. So I think it reduces the sweating to such an extent that they can put up with their life and get on with it. It adds to their confidence, and I also think people are genuinely worried about their sweating because it forms a patch under the underarm, their shoes or their feet smell, and they feel conscious about it. I think reducing these simple things can give so much confidence to the patient that they go out and feel better about themselves, and they can then form better social relationships and work relationships and get on with it.